Hello and welcome to CIO Live here in ASEAN. My name is Chris Holmes, Editor-at-Large, and I will be your host today. I'm pleased to welcome Andri Hidayat, Digital Service Transformation and IT Director at PT Prodea Widyasada from Indonesia, as part of our Leadership Live series, where we talk to tech leaders across the region. And I know we've got a very interesting story to talk about around the digital transformation project that Andri has been leading. But before you do that, Andri, maybe you could just give us a little bit of a background as to, where you came from, because I know you're not an IT professional from your training.
Yeah. Thank you, Chris. Yeah. Hello, everyone. Actually, I'm already worked in Prodea around 26 years this year. I started from 1997. And actually, my background is a pharmacy, and also I'm a PhD for biomedic in Faculty of Medicine. But my journey is in career is very interesting. Actually, the first time I joined in Prodea, actually I am as a assistant manager for technical and quality control. So my job is to make sure every test in Prodea in all branches have a good quality. So I conduct some external quality assurance, internal quality assurance, and create some standard procedure and something like that. And the interesting one is when after 6 months I'm joined with Prodea, my operation directors suddenly asked me to create a new solution for quality control system in Prodea. So that at the time I'm still not have experience and knowledge about the technology actually, but yes, I accept that challenge, and I have 6 months to create a solution. And I tried to learn myself about at the time about the FoxPro, maybe you know the FoxPro language. I take a course, my personal, at the night. And then, yes, I can create a new solution for monitoring quality control in Prodea, and it's still used until maybe around 10 years ago. That's a very long time. So that's the first time I have experience with technology. And then after that, I moved to Medan, North Sumatra, to take a business in Prodea for North Sumatra area. So mostly at that time, I work at the business and marketing. And then in 2012, I asked by my CEO to help Prodea IT team to lead as a caretaker for PMO, IT PMO. We have a project to modernize our ERP at the time. And yes, that's a project is a big project for Prodea at the time. And yes, we can change the system and implement a new system at 1 year. And then management take me to the head office as a IT PMO. Now that's the start point as for me to work at the IT things. Yeah. Then at 2014, I have roles as operation and operation directors. And IT is a part of operation. Operation I conduct about the technical laboratory, logistic, and also for information system. And now in 2021, we have a new process, a new structures. So I have a new responsibility as a digital service transformation and IT directors. That's my journey career, 26 years work in Prodea.
Fantastic. So, I mean, you started to sort of give some idea as to sort of what Prodea actually does. Maybe you could just sort of share, what the organization does, how they actually operate, and then we can start to talk around that digital transformation project.
Yeah, Prodia as the largest lab in Indonesia, we have around 278 outlets around Indonesia, and we have cover around 135 cities in Indonesia. So our business model is we receive the samples or tests from direct customers and also from doctors, and also we receive from more than 1,500 hospital and labs. They send or refer tests to Prodia, and also we have customers from B2B, like for medical checkup from companies. Yeah, so that's the roles of our business model in Prodia, and then yeah, mostly like others laboratory, we conduct all the business by offline. Yeah, so the customers should come to Prodia. They take a request session from clinician, yeah, come to Prodia. That's the business model in Prodia. So yeah, before we create some transformation in digital. Yeah.
So, and again, I mean, when you and I were talking prior, I mean, obviously the pandemic, COVID, I mean, that had a huge impact and actually led to this digital transformation. So maybe you could just share a little bit about that.
Yeah, actually, we already have a roadmap for transformation. Actually, before the COVID, it's around 216 and 217. We create a new Prodia IT blueprint. Yeah, and mostly we prepare for digital process. So that's why it's we are very lucky when we already implement some initiative in 2016, until 2019. So when the pandemic hit us in early of 2020, then we know everyone and also in Prodia have very impacted to this pandemic. Our business is dropped very significantly, and suddenly all the employees should work in home. Yeah, at the time, yes, we already set up some system to work from anywhere, so we not have a problem for that. But the interesting one is when before a pandemic, when we try to socialize, to roll out the system, it's very hard to our employees to use that system. Yeah, sometimes they feel in offline or meeting with directly is a very important things. It's not easy. It's not common to discuss in of online. But suddenly after COVID, all the system, we have a problem. We have a complaint from our employees. Then when we use the same system without any change anything in the COVID era, then all the employees use that the system. So I think the important thing is how we change the habit, right, to use that system. So that's the condition. And of course, when the COVID hit Prodia, we also try to review our business process. We try to focus, consolidate our system. Yeah, and in Q4 in 2020, we have a rebound. So at the time, we already done some project in digital, and also at the time we expand our organization. Actually, at the pandemic, we create a new team. We create a new structure for enterprise digital and data management, and also we create a digital transformation section. So pandemic also give us a very good lesson about this, about how we change the business process and how the customer change needs. Yeah, so we must consider that customer needs to change our business process to make a customer easy and convenience to transact or interact with Prodia. Yeah.
So, I mean, when you had that digital transformation initiative, I mean, where did I mean, particularly during that COVID era, I know you talked about having that blueprint. I mean, was that something that came from the CEO? Was it something that came from the business, or was there sort of a senior management team discussion to actually come up with those objectives as to how we were going to move forward?
Yeah. Actually, it's drive also by our CEO. Yeah, she have vision to change Prodia as a digital company. That's why in 2016 we start to discuss internally with all the stakeholders, including with the business, finance, IT, and also from operation, what we should do for Prodia in the futures. So we create our vision and mission, like we would like to focus on precision medicine, how Prodia can support precision medicine and personalized medicine. That's one our goals. So we focus on how we can create a system in Prodia to achieve that in terms of information technology, and then from in vitro diagnostic technology, IVD technology. That the two area of technology we developed. So started at the time, we also developed genomic testing. Of course, genomic testing needs IT capabilities, good IT capabilities, including like bioinformatics. Yeah, that's at the time a new area for us as well. Yeah, so we work together, all the organization member, to create a new our roadmap at the time. Yeah.
So, I mean, you talked about a few things there in terms of this digital transformation project. There was obviously, allowing the employees to sort of work from home, but then also those new product areas and moving towards the digital. So how did you actually structure these different work streams? I mean, what was the organization you put in place to implement this?
It's actually, it started when I led the IT team in 2014. Yeah. Before that, all IT project is led by IT people. So at the time, looks like all the technology is responsible by IT. So everyone outside IT have a perception this is IT responsibility. So everything have a problem with the system, they ask to IT. What happened that? And started in 2014. I changed the concept is every technology project should lead by a business people. So like ERP implementation in 2012, 2030 at that time, I pin tax manager actually as a lead of ERP implementation project. And then for CRM, I put research support manager as PM for CRM implementation. And then I look when we do that strategy, all the business teams, they involve directly to technology project. Of course, the second line or co-PM is come from IT people or from business technology people. Yeah. This combine is very effectively to change our cultures, digital cultures in Prodia, in all employees Prodia, because they directly involve to the process and they lead the transformation of every technology project. Yeah.
Very interesting, very interesting. And I mean, maybe you could just sort of share some of the successes that you've had. I mean, obviously there's the sort of project, the implementation, the adoption, but I mean, also just changes to, the way the business operates, the way the business runs, and the bottom line results effectively.
Yeah, of course. Like in 2020, we start to change our business model from 100% offline. We try to create a new solution is we create a digital solution for direct customers. At the time, we start before pandemic, actually, in 2019. At the time, we run the project to create a digital solution for customers, so customer can register, can also can discuss or consult with doctors, at the time. And then suddenly, when the COVID, that's a very important thing. When COVID, all the healthcare provider focused to manage COVID disease, right? And including in Prodia. But we look at the very situation in market. At the time, all the patient, non-COVID patient, they have struggled to connect or to visit the healthcare provider, because all healthcare providers have a very big COVID patient. So they are very afraid come to a hospital, including to lab, like for diabetic patient, hypertension patient. They also have a potential is a very high risk for the COVID. So at the time we use this solution, focus for non-COVID patient. And then we implement in 20. Actually, this solution already implement in 2017, and then at the time the user is very small. It's only around 0.6% from total our revenues and traffic. And then when we launched that a new solution, new digital solution with a focus from a customer perspective. In 2021, we increased our revenue share from digital to 6.1% from 0.6. And all the digital transaction is non-COVID patient, actually. And then in 2020, we double it to around 15%. Now, today we have around 19% from our traffic and revenue comes from digital. That's a very significant result from our digital transformation in terms of we changed the business process for customers, for customer journey.
That's amazing. That's a tremendous growth there from that sort of shift to digital. And I assume the business has been growing as well. So I mean, it's
yes. In 2021, we have a very good growing in our business.
Oh, very interesting. And maybe, Andre, you can just sort of touch a little bit as well around some of the projects that you've implemented. I mean, you've been talking through the projects, but I'm also interested in just in terms of that sort of what makes a project successful as you go through that journey. I mean, you talked about the fact that you've got a business lead and an IT lead, and this sort of this combination, and it's changed the culture. Maybe you just talk a little bit about how successful that has been.
Yeah. In Prodia, we have three pillars of digital transformation strategy. First is we focus on optimization and modernization our business process. And the second is we create a new business model for create a new revenue. And the third is we build our digital cultures. All the three pillars, we run this many projects over there, and led by business people as well, and also combined by digital and also by technology team. We call it as a pizza team, fusion team, like a fusion team, because every department over there. And then we have three objectives actually. We start from our inner. The first objective is we would like to create a new digital mindset to create digital cultures in Prodia. And the second one is we would like to create a collaboration, digital collaboration with all healthcare providers, because healthcare solution should, we cannot run by ourselves. It should be a collaboration with others. Yeah? And the third is we focus to customers. We would like to give extraordinary customer experience with a digital solution for us. That's a three objective. With three pillars and three objectives, we create many project and initiative for customer side and also for internal side for modernize our system. And then, of course, the very important thing for PI is how impacted this to business. Like I mentioned before, how we can grow the contribution of digital revenue. And the second one, of course, we must calculate our return on investment. Every IT project should can describe in a financial perspective as well, right? And second, and then the third is we also have a PI to make sure our business process in internal Prodia is going more efficient and more lean. Yeah, that's why every project should create, maybe they can reduce 20% or 30% of process, possible to cut the process, something like that. That's the three major PI we calculate, we measure for the result of the digital transformation.
So very interesting there. So again, you're talking about the revenue generation, you're talking about the sort of optimization, and the efficiency drive. And these are, in fact, in our latest CIO survey, they came out as the top things that, CIOs are focused on. But what, maybe we can just explore a little bit, because I think it's very interesting that you said, the financial metrics tied to those sort of technology projects. So how do you actually decide to invest in a new technology? How do you, let's just take artificial intelligence and maybe generative AI, as an example. How do you actually look at that? How do you bring it in? How do you decide which sort of projects you can apply it to and which processes? Because something like generative AI can have a huge impact in the way you actually operate today.
Yeah. That's a very interesting question, Chris. Actually, we know today we in several years we facing many very interesting technology. It's a very huge technology and very growth many new technology. That's why we are very important things to know what kind of technology actually the priority we need and support our business. Not every new technology we should implement to impact it directly to our business. Of course, we must monitoring the every new technology. So we have a team to review all the technology comes, and we have a research team, and also we inline, as I mentioned about the business goals. So we would like to be support as precision medicine, and Prodia also we would like to going to personalized medicine. So which technology can support this? So we focus on that, like bioinformatics. That's a new technology. Is not easy to create that, not just in terms of technology, but also in terms of people. Yeah, in Indonesia is a very limited resources for bioinformatics. So we collaborate with development team, business development, and also test development to create a new solution for this. So we support to create solution. That's why in last 10 years, we launched many genomic product, like a nutrigenomic, sport genomic, and also skin and hair genomic. all the product is come from bioinformatician, from bioinformatics system. We also modernize our genomic management system there. And then also we, of course, in the healthcare, the important thing is about the data and security. How we make sure every aspect in Prodia have a secure, a secure layer. That's also the technology which we should review and modernize by every years. Yeah. So when we talk about the other technology, maybe like a metaverse, yeah, yes, we explore, but we still not put that as a priority, because we think in Indonesia market and also in healthcare, this is still we review which area, which business case are better to implement this. But like teleconsultation, telemedicine, also for like genomic I mentioned, that's a very interesting thing. And of course, like new AI for chat. Yeah. AI is one area, is a very, very huge and very impactful for healthcare. We also review this. We create a new solution from AI to implement for support our business solution. Yeah, like that's the process. So we not decide by technology team self, but also we discuss with the business. Is it good or not a solution for a business, and how business have vision in the futures, and how technology can support that vision.
So really bringing those two teams together and actually just seeing how. I mean, but I think it's such an interesting area at the minute, particularly around healthcare, with the scale of compute that's available now and the speed of compute. And you talked about bioinformatics. I mean, there's so much advancement going on in that area today.
Yeah, that's right. Like a genomic result is example like this, Chris. With genomic testing, one patient is create around 1.6 gigabit data with a CSV format. That's a one patient. So you can imagine if we have 100,000 million patient, that's needs a good solution to manage all the data, including hardware, software solution for that.
Yeah, so the whole infrastructure needs to be behind there as well, so you can actually
and also security layer for that, right?
And security. Wow. Andre, we're coming to the end of our discussion. I know we could have gone much deeper into a lot more areas, but maybe you can just give us a sneak peek into what's next for your organization's transformation story.
Yeah, thank you. That's an interesting point, Chris. We know and we look digital solution with very seriously. That's why at the last years we create a new entity. We call it Prodia Digital Indonesia. This is we spin off digital initiative from our major business. We are business in clinic and clinical laboratory. So every digital solution for patient, now we put at that new entity, because we hope we can more focus. We can create more capabilities on there. Yeah. And the second one is with this, we also focus to create a new solution for wellness, not just for treat the patient, sick patient, but how we can predict and also can prevent using a digital solution. That's the process we create now, and also hopefully in several years in the futures we can create a new solution for this, so the patient can use digital solution combined by laboratory testing and also clinical solution to bring their health more better, their health better by preventive and predictive. Yeah.
Well, that sounds fascinating. Getting that predictive and preventative, it's much easier to prevent stuff rather than trying to cure stuff.
That's right. That's right. That's why we focus to bioinformatician to support bioinformatic to support genomic, and also now we try to explore the epigenomic. Epigenomic is an area which everyone knows they have a modality in genomic, but sometimes genomic can change by environmental, like a food, and weather, everything. That's called epigenomic. Epigenomic is a new area, and that's a new test for a solution for preventive and also for predictive. Yeah.
Wow, very interesting, very interesting. Andre, thank you so much for sharing your journey, both as to how you became a tech leader, but also your experience in running those digital transformation projects. Very interesting, and also showing those amazing results in terms of the growth.
Thank you so much, Chris.
So that concludes today's CIO ASEAN interview. My name's Chris Holmes, and I've been talking to Andre Hidayat, Digital Service Transformation and IT Director at PT Prodea Widya Husada. If anybody's got any questions, comments, please reach out to me on LinkedIn.